think one of the most notable things is a story about a patient that had received treatment from her oncologist and was told, like most patients, that her hair would fully regrow after 6 months. And here we are a year later, and she has almost no hair. The patient had received docetaxel chemotherapy, and of course, this was an unexpected event, very infrequently reported adverse event, although increasingly has been reported. And it is probably the only time that I've seen a patient upset at their oncologist, because oncologists do amazing things for patients, of course. And there is a lack of awareness of this persistent alopecia topic. And I would like to ask Dr. Dilawari, what kind of conversations do you have with patients about hair regrowth before you start chemotherapy?
Yes, I think this is an excellent point because, as many of you know, when a patient first starts chemotherapy, there are so many things to discuss, the logistics, schedules, side effects. And I don't think that medical oncologists probably do an adequate job of talking about survivorship at that point. I headed the survivorship program at Georgetown, and talking about recovery after chemotherapy, hair loss is absolutely factors in to body image, psychosocial wellness, and even both during and after chemotherapy. So I do talk about the docetaxel. Actually, whenever a patient is starting docetaxel, I do mention the few cases where there was permanent hair loss. But beyond that, I think most of us have very general discussions about alopecia. And although most of our patients bring that up right away, we do have the discussions about hair loss during chemotherapy. I think what's lacking is probably the discussion of regrowth and recovery after chemotherapy is completed. And only recently, I have to say, is scalp cooling coming into this.
And Dr. Coley, from a breast surgeon's perspective, uh, I know that you see patients early on and then perhaps later on during therapy, right? When you're doing the reconstruction or when you're doing subsequent surgeries or reconstruction. So, what do you think is the breast surgeon's role in scalp cooling and in these kinds of hair-related recovery issues in our patients?
Oftentimes, I'm the first person seeing the patient when they're diagnosed with breast cancer. So I often carry the workload of managing expectations of what their treatment plan is and what the side effects might be, short term and long term. And it's an overwhelming time for patients. They're not expecting to ever get breast cancer. You're having to break the news to them, tell them what their stage is, outline a treatment plan. And a lot of compliance comes into really addressing their concerns, because some patients decline treatment over concerns regarding side effects of care. The first step is reassuring them that breast cancer in particular has very good survival rates overall. So my first step is reassuring them that long term, that they will be here provided we get through certain steps along the way. The other is, in the short term, their fears may not be valid in today's world. They may be comparing what they expect to, movies that they've seen of patients undergoing chemotherapy. I can never get into as much detail as my medical oncology colleagues, but I think that setting them up for that consultation is important. So, a lot of patients are, first of all, scared that they're going to get chemotherapy. And many don't realize that not all breast cancer patients need chemotherapy, but if they do, then it's a matter of, is this chemotherapy regimen more likely to cause alopecia? And what is the way to address that? So that's when the conversation is started and they start thinking about, okay, if that's my main concern, sometimes there are patients that have young children, and they can't handle the conversation of, why their mother is losing their hair. Other times they may, know that they're going to end up losing their hair despite using scalp cooling. And encouraging them to stick with it is important. And those are the patients that I see who are getting neoadjuvant treatment prior to surgery. And I may be having frequent check-ins with them pre-surgery, that, they expected to keep all of their hair. Then they saw some thinning. Then they saw that they did lose their hair, and encouraging them to stick with it, because if they can at least retain their hair follicles, they'll hopefully have quicker regrowth. So I think my role as the breast surgeon, even though I'm not the one doing the scalp cooling, is introducing them to the information first off, and then encouraging them along the way to stick with it, with the ultimate long-term goal of, meeting all of their vision of how life could be, getting back to normal that much sooner and feeling like they're still themselves.